Welcome to the pharmacology class, and today's topic is drugs for anemia. Anemia is a disease that uh, is
So
resulted from. Sorry,
how we can see the lecture because it's just your
I will show you the slides once I will
ah,
meet them. So
okay.
before the before that, please listen to me and uh,
Sorry.
watch watch my face only.
Okay.
Un- Unfortunately, I can't show you any other beautiful images before, but I will try. I will do my best to prepare beautiful images so you can enjoy the animation too.
Okay.
So the uh, anemia usually results from the decreased level of the hemoglobin that is synthesized in the body. So if a hemoglobin is synthesized. Uh,
Hello.
Hello, Baha. We just started the lecture.
Uh,
Please enjoy the lecture and listen carefully.
okay.
So the hemoglobin is synthesized from the iron, and usually the deficiency is resulted from the deficiency of the iron. That can be increased amount in the iron, or it can be uh, decreased intake of the iron. For example, during the uh, staff stuffing, or uh, during the disease that prevents the absorption of the iron, or after some surgery of the stomach uh, that leads to the prevention of the absorption of the iron, because the iron is absorbed uh, with the help of the uh, uh, transferrin that transfers iron to the ferritin complex where it's stored in the liver. So also the high demand in the iron can result in the iron deficiency anemia, and that is usually case in children because they grow fast, and the fast growth usually requires higher amounts of the iron. Another group that is uh, usually diagnosed an anemia, iron deficiency anemia, is pregnant women because they require more iron for the for the fetus, and also a highly menstruating woman that lose the blood and iron with the blood. So all these conditions can lead to the iron deficiency anemia, and the primary treatment for these patients will be uh, iron uh, preparations. So iron is usually administered orally because it's well absorbed after oral administration, unless the absorption is diminished or the patient cannot take oral medications. In that case, the iron can be uh, introduced intravenously or subcutaneously. So most of the orally absorbed iron uh, have a high bioavailability, and the bioavailability depends on the amount of the iron in the body. So when the amount of the iron is low, the absorption is increased. When the amount of the iron is high, the absorption is diminished. And also the lower doses of iron are absorbed better, and that is why most physicians will prescribe or will divide the dose of the iron, the daily dose of the iron to 2 doses or to 3 takes a day. So the 3 takes a day will reduce every dose twice or thrice, and that is why the bioavailability will be higher, and that usually leads to less adverse effects and also better compliance from the patient. The oral drugs for iron are usually salts, with the most common salt is ferrous sulfate, but also the ferrous fumarate and ferrous saccharine and other organic compounds that have higher iron or, or iron percentage. So the ferrous sulfate is one of the cheapest one and have about 30% of the iron, and the extended release preparations can have at up to 100% iron, uh, but they are usually much more expensive and not readily available in every hospital. The iron usually well absorbed in the acidic uh, in the acidic stomach, because in low pH the iron is stored in the reduced form, and it is the active form of the iron and is well absorbed in the intestine. However, because of the adverse effects, uh, some patients may complain for the diarrhea, the constipation, and GI disturbances and pain. So these are major complications for the oral iron administration. For when the higher doses and um, faster onset of action is required, the uh, the intravenous formulations are used, because the oral iron is only effective after several weeks of the treatment. So the onset of the action is very slow. So faster um, when the faster action is required in emergencies cases, the the intravenous routes is available, and subcutaneous injections are also available. The adverse effect of the parenteral formulations is heartburnings and also the uh, flashes. So, and they are usually compliance is lower from the patient. Because they still require daily dosing, except for the extended release preparations. However, extended release are less reliable and also can lead to some uh, immunoreactions like iron dextrophan is a common can can lead to the anaphylactic reactions because the dextrophan is consumed by the macrophages and the iron is released by them, so it can then transfer to the ferropoietin. Sorry, with the transferring to the ferritin. So the iron in the body is stored with the ferritin as a complex, and it is transferred to the ferritin by transferrin, another protein. So there is a special transport system in the body and also the storage system in the body that makes sure that there is uh, a pool of the iron in the body in case of the uh, absence of the uh, iron intake with the food. So the symptoms of the iron deficiency will start about several weeks to months from the start of the uh, reason of the reason of the absence of the iron, because there are some storage of the iron in the body, and unless that storage is depleted, the iron deficiency symptoms will be not seen with the patient. This is most common anemia, iron deficiency, most common in children, and other symptoms so for the iron deficiency, the symptoms include the pale skin, or the uh, tachycardia, the uh, uh, the insomnia, and loss of appetite. Um, Also pica uh, when the patients try to eat the dirt and the paper. So and um, also a condition of the nail that is called uh, this type of the nail, and especially seen in with the starving people. So these symptoms will eventually lead to the pale skin also, and tiredness, and these symptoms usually um, a patient usually submits to the physician with these symptoms. So there are three classes of the uh, drugs are used to treat anemia, and um, the first class is uh, iron, and iron uh, is the most widely used for treatment of the anemia, because the iron deficiency anemia is the most common. So the second uh, type of the anemia is and the iron deficiency anemia is called microcytic, because the erythrocytes are small, uh, and the hemoglobin is low. So this is most common condition. The second type of the anemia that is seen is megaloblastic anemia, and megaloblastic anemia results in a large erythrocytes, because they cannot proliferate, they cannot grow from the uh, uh, large megaloblasts. So, and they stay large, and they cannot pass through the scapulary, so through the smallest of blood vessels, and they cannot actually transfer oxygen. So this is a particular problematic disease. So and the megaloblastic anemia results uh, in decrease in folic acid or cyanocobalamin levels. These two vitamins are essential for production of the uh, purines, and then that eventually leads uh, to the megaloblastic anemia. Megaloblastic anemia can also result from uh, treatment with uh, the drugs that inhibit the tetrafolic acid reductase enzyme, that is converting folic acid from its inactive to the active form, the tetrafolic acid. For those patients that have this enzyme genetically reduced, the active form of the folic acid, that is called leucovorin, is available. The folic acid deficiency is commonly seen in pregnant women, because uh, during the pregnancy the woman requires more folic acid than usual um, population, and that is why the increase in the diet with the food that is rich in folic acid is required to prevent the deficiency in folic acid. And this is especially important for the pregnant woman during the first 2 weeks of the fetus development, and because the woman is usually not aware she is pregnant during the first 2 weeks, because usually she is aware only when the menses were late. So that is why it is important to have a high level of the folic acid for all women that are in the age of the uh, and in the childbearing age, and don't use contraceptives. So the cyanocobalamin is will result the same disease, but the disease is mostly neurologic, and results in if left untreated, results in damage to the neurons, and that is why it should be treated promptly. Fortunately, the cyanocobalamin or, vitamin is required in very small amounts, and the body has a storage that will last for half a year. So for that reason, the deficiency of this vitamin is very rare, and usually results from the chronic alcoholism, or the condition that leads that prevents the consumption uh, of the vitamin with the food, or the uh, disruption of the absorption in the GI. But usually, unless the patient is not starving for a long time, like half a year, so if it can only be seen in homeless people that are starving for a long time, and is very rare in developed countries at the moment. So these are three most commonly used drug: iron, folic acid, and cyanocobalamin. Because these conditions are pretty common, and these two drugs are dabroprotein and epoprotein alpha are used or seldom, because these are new drugs that developed recently for the stimulating the erythropoietin, because erythropoietin is a factor that will increase the production of the erythrocytes from the colonies. So these two drugs will act directly, so are very effective in case of the uh, in case the erythropoietin production is diminished, usually because of the disease or because of the genetic disorder. However, they are not available in every hospital and require dosing and injection, so used only in hospital and not used outpatient. And also those both of them, erythropoietin alpha and dabroprotein, require the iron supplementation, because of the erythropoietin is only factor that will develop will increase the production, but still the body will require the iron and all the components to produce the erythrocytes. So the anemia, so all these drugs, iron, folic acid, cyanocobalamin, dabroprotein, and epoprotein alpha, will treat the anemia that is acquired during the pregnancy, during the childhood, because of the lack of the because of the starving, and but there is also an anemia that is not acquired. It is genetically present from the birth, and this is a sickle cell anemia. Sickle cell anemia is anemia that results in the in the increased amount of the hemoglobin S, that is not a good hemoglobin, and eventually, and also the lack of the uh, ability to synthesize the normal hemoglobin, that is hemoglobin A, that is adult hemoglobin, and uh, the the uh, when the children born, they have a fetus hemoglobin predominantly in their blood, and eventually during the development of they acquire an adult hemoglobin, and adult hemoglobin uh, sequentially will replace the fetal hemoglobin uh, up to the age of 5 or 6. So and usually the symptoms of the sickle cell anemia are seen at this age, at the age of 5 and 6, when the amount of the fetal uh, hemoglobin is reduced, but the amount of the adult hemoglobin is not increased. Instead, it is replaced by the hemoglobin S, that is non-functional. So, and unfortunately, there is no drug for treatment of this anemia. However, the symptoms can be reduced by the administrating of the hydroxyurea and pentoxifylline. These two drugs have a different mechanism of action. Hydroxyurea will increase the amount of the hemoglobin F, fetus hemoglobin, while pentoxifylline will uh, increase the amount of the hemoglobin and uh, proliferation of the hemoglobin. So these two drugs will reduce uh, the destruction of the hemoglobin S, and that is why it can lead to can prolong the life of the patients up to about 20 years old, but eventually they will die. And the sickle cell anemia symptoms usually result in the pain uh, because of the vessels uh, will be clotted uh, with the sickle cells, with the erythrocytes that have a moon-like shape, because the hemoglobin S that is synthesized will be will be polymeric, and the molecular will be so large it will not fit the erythrocytes. So erythrocytes have to be shaped to the moon-like shape to fit the molecule, and they also cannot pass through the small vessels and will stuck in the vessels, and that will lead to the ischemia and pain. Usually pain is in the extremities first. So, and the third disease that is actually not anemia is neutropenia. Neutropenia is treated with the factors that will stimulate uh, colony stimulated factors for the mm, for the neutrophils, and all these drugs are DNA engineering drugs. So filgrastim, pegfilgrastim is pegylated derivative of the filgrastim, sargramestim, and tibiofilgrastim. So they have common gram here. So these drugs are used to treat the neutropenia. Neutropenia is usually results of the uh, treatment of the uh, cancer, or the neutropenia also seen in HIV patients. So other reasons also there are other reasons, but less common. Can be from the organ transplantation or the radial exposure. So the neutropenia usually results in deficiency in the immune system, because these cells are developing the immunity response of the body, and the treatment is aimed to increase the uh, production of the neutrophils, so to prevent the neutropenia. So neutropenia is actually reduction in the production and in the number of the neutrophils in the body. So these are the main diseases that we should discuss during this lecture. And what are your questions about all this?
No.
No questions at all?
Yes. If we have, we will ask you next time, because today we will try to study what we gave us then.
But so when I explain to you, is there anything that you are not understand from the first time? It's better to ask.
Okay. But we don't have now. For me. For others, I know.
So everything is clear. Like every definition is, you know, everything. What is erythrocytes? What is neutrophils? So you have an idea what is anemia.
Yes.
So what is anemia?
Anemia, it's for example, when someone have less hemoglobin.
Only hemoglobin?
No, but that's why I remember.
Okay. So what is the result of the hemoglobin decrease?
Guys,
Everyone is away. Bushra, you can. So I think you are the only one left because the lecture is very boring.
no, it's not.
It is.
Now.
And
We are
Hawa
here.
just wake
No,
up.
no, no, we are here.
Okay, I cannot see you anyway.
I'm sorry, I
No,
just
we are
have
hearing you,
children
sir.
in my room, so I can't open my microphone.
We can hear you, sir. We are
I'm sorry.
staying on the line.
That's fine.
Yeah.
That's fine. So any questions?
هو ده دكتور يا بنت؟ No, thanks.
Allah.
Baha, he just lost the connection, sir. He called me now. He said, I lost the connection. I will
Oh.
enter now again.
That's no problem. The lecture is recorded. Then you can download it after about 1 hour
Okay.
from the portal. So there will be a link to download the lecture. Allah, could you please show us the small student?
The baby.
Yes.
I'm sorry.
Okay, maybe next time.
Okay, I
So,
can show one.
I think it is the youngest student of mine.
يا بت مين دول؟
Sorry, the internet
They
was
don't
so
know.
weak. I had to
وينهم؟
close it and open it again. هو
لا وينهم؟
ايه اللي عم يحصل؟
Oh, that's fine. So if
yeah,
there are no questions, so we are almost done. And
no questions.
we have a practice after this lecture.
What we have?